Hey, it's Jessica DaMassa with WTF Health. I'm here at Health Datapalooza, and joining me right now, I have Don Rucker. He is the National Coordinator for Health IT. Good to have you with us.
All right. Yep. Thank you very much.
All right, so what's the update? What's going on from the ONC's perspective?
Well, the big thing is getting patients their data on their smartphone.
Okay.
So for the first time ever in our lifetimes, and ever, I guess, with modern electronics, we have a way to get patients their medical records on their smartphone so they're in control. So they get their record. It will be free to them and their apps.
Okay.
And it will be part of medical care. This has been mandated by Congress and the President under the 21st Century Cures Act. Very, very exciting. We're bringing the technology on the smartphone that's changed all the rest of our lives, banking, weather, airlines, sports, music. We're bringing that to healthcare, finally.
Finally. All right, so
Finally.
what should we all do? The community of innovators, the community of IT folks out there, what should we be looking for as this starts to unfold? First of all, what's the time frame for it?
Yeah, so our rule is being worked on as we talk here today. There's a public comment period depending on when you watch this. And what you need to think about first for the innovators is application programming interfaces. How does software talk to each other? Okay. If you get a ride on Uber or Lyft, there's probably easily half a dozen APIs, the map API, the traffic API, the credit card API. We need to start thinking about that way of thinking in healthcare, bringing things together, having new products, new services, and then there'll be a 2-year period for that to all roll out between the electronic medical record vendors and the providers. But for right now, think API, application programming interface. That's what fuels all the stuff on your cell phone. We're using the modern internet cell phone standards for that, RESTful, JSON, and FHIR, as opposed to sort of more cryptic healthcare stuff. And, there's lots of developers who can do this.
All right, this is a big announcement here. I mean, this is like I think what a lot of people have been waiting for. I mean, not only on the from the sense that patients get access to their data, but I think all of the innovators out there who want to build things that can make that data even more useful. I mean, this is something seminal, right?
Absolutely. We've had this digital divide where when you look in the past, you could do a healthcare app, right? A diet app, an exercise app. But you couldn't get any medical data, right? The medical data was sort of hidden away, sort of a couple vendors, not really in any way accessible, and certainly from the public point of view, totally inaccessible, couldn't be combined with anything now. And again, all of this is still under the HIPAA Privacy Act. This is super secure, OAuth 2, the modern security standards that are used by every banking app, every brokerage app, all of that security. But now these apps of the patient's choosing, I might say, and hopefully choosing wisely, because it is your medical data that you're going to have in that app, and you want to think about what their business model is, how it would be used, and make sure it's not reused. But now all of that can be integrated. We think it's going to be a total game changer in American healthcare, and lots of transparency.
Okay, so more on the transparency side of things. So, I mean, give me like the vision for that, because this is not just transparency where patients are able to see, what's going on like in their record, but there's also like different kinds of transparency that's going to like kind of snowball from that ability to do so. Yeah,
so there are a whole set of transparency provisions in the rule. So first of all, it's just, of course, having standards-based APIs so you can get your clinical data. You have to, when you look at buying something, right, there's information. There's two things you need to buy something intelligently. A, you need to know what you're buying, right, the product or service. And B, you need to know how it costs, what it costs. In healthcare, we have neither, right? We don't really know what we're getting, and we have no idea what it costs. So with the Cures rule, as an absolute start, we're going to have a lot better sense of what we're getting. We have a request for information to think about how we can start injecting price transparency into the system. That is very early. The lack of price transparency in healthcare, as everybody knows, who's looked at an explanation of benefits, is absolutely Byzantine. But, we're starting to work on cracking that nut. A lot of interest, bipartisan, in doing that, frankly. So you have to have both of those, but the transparency, hopefully, will be everywhere, right? So you're young, but maybe I'm not. So I remember when there was no real transparency on airfares. You negotiate with a travel agent, right? There was no transparency on, mutual fund fees, right? We have transparency throughout our economy now, except in healthcare. So this modern computable thing, and if folks aren't transparent, it'll start to be really obvious. It'll be, oh, wait a minute, why aren't they giving me my data?
That's right.
Right? Why aren't they providing my data for me? So,
Okay, and I'm curious about, along these same lines here, I wanted to ask you, so moving forward, I mean, what we're seeing more broadly here is this trend of consumerization in
Yes.
healthcare. And to your point previously about, we don't know the product and we don't know how much we're paying for it. This has the potential to really actually make us consumers of
Yes,
health. So, I mean,
exactly.
weigh in for me on this consumers. How do you see this playing out? How different is healthcare going to look then 5 years from now as this rolls out, as people get control over their data, as the transparency starts to permeate all aspects of the industry? What's the long-term vision from your perspective?
well, I think when you look at other industries and you sort of look at with a sense of business history, right? How have other industries been transformed? I think you will see there will be lowering of prices, right? I mean, that's just the way this sort of works in the world. There will be a lot more competition. Right now, a lot of the big delivery systems have a business model where they get large enough so that the insurer in that state has to basically have them in network at the delivery system's price, right? And part of that is because there's not a lot of transparency. That business model may actually collapse, right? It has in other industries. Now, there may still be consolidation, but it'll be consolidation driven by efficiency as opposed to consolidation driven by reduction of choice. So it'll you can't predict the future, but I think it'll be transformative, and there's so much opacity, and many of these prices and services, they're very ill-defined. So I think it'll be a lot more consumer choice, and people will be empowered. They can ask, right? What's this? Right? The same way, if you have a question on something, tell me, why should I buy this? Why should I do this? Rather than being these very, I think, honestly, paternalistic conversations that we've had. Oh, the patients can't be trusted with their data. It's too complicated. I personally think that's nonsense. The entire modern business world is built to hide complexity. Have you ever bought anything from Amazon?
Yeah.
Yeah. Okay, just checking, right?
Right before this interview.
Yeah, right before this interview, right after the interview, right? We don't really know right? There's a ton of complexity there. We don't know how they get all this stuff in the warehouse and ship it and all of that stuff, right?
Just wait till they start doing healthcare, right?
Yeah. Well, but we need new competition in healthcare, and we need that efficiency, and that's what the consumer is going to see. They're not going to have to go alone on some deep medical decision. They're going to the marketplace will present information to people in a level that we can deal with. Right? That is what the market does in anything else. We don't know any of the complicated technology and how it works, right? You're holding a microphone. Neither of us have any idea how the microphone works. I mean, there's electricity. It works, right?
And it's interoperable with that camera.
And it's interoperable with the camera, exactly. That same thing will happen in healthcare. So we want to banish the paternalism and put people back in control. That's what the president has talked about extensively. when he campaigned, and that's what this administration, what we're trying to do. I think it's actually a very bipartisan thing. I think there's both parties have a lot of interest in this.
Okay, last question for you. I'm curious as like, I mean, I'm a healthcare geek and also a data IT geek, and so are you, I would imagine, in your role. So I mean,
Apparently,
no.
yeah.
So weigh in for me on what you're excited about. Like, are you excited to see some of these big tech companies like Amazon get into the fray here? I mean, like from a business standpoint, and also from the IT standpoint. I mean, how do they get me my groceries in 3 hours?
You know, honestly, I'm more excited about entrepreneurs whose names I don't know, who are where I don't know where they are. Who are dreaming up new things because they're creative, and you know, maybe I'm not. I'm excited about what I don't know and the entrepreneurial unleashing of the American creative enterprise juices to address these issues. That's what is totally exciting, because this is the first time they've had that opportunity since 1965.
Awesome. Well, we'll see what happens. All right, thanks so much for joining us. So good to talk to you. I'm Jessica DaMassa with WTF Health here at Health Datapalooza. Thanks for watching.